Two Americans working in Africa have tested positive for the Ebola virus. Both are part of a team fighting an outbreak in West Africa that's killed at least 672 people since February. Mark Albert has more on this.
Kent Brantley knew the danger, but when an Ebola outbreak hit Liberia earlier this year, the 33-year-old doctor from Indianapolis stayed to fight it, as did Nancy Reipel, a hygienist from Charlotte. The Ebola virus is highly contagious with close contact and is fatal in up to 90% of cases. There is no known cure. Doctors treating Ebola patients wear full protective gear such as these synthetic suits and goggles. But Brantley still got infected, as did Reipel. Samaritan's Purse, a North Carolina aid group, is supporting the team. Vice President Ken Isaacs says it is investigating how the two contracted the virus.
Dr. Brantley and Nancy are both in stable condition tonight. They have fevers, they have body aches and pains. They are not out of the woods yet. Our prayer is that they survive, and tonight they're in stable condition.
Isaacs said Brantley and Reipel started showing symptoms a few days ago and immediately isolated themselves. A CDC test confirmed the diagnosis by Saturday, the same day a senior Liberian doctor died of Ebola. William Schaffner is an infectious disease expert at Vanderbilt University.
This is a very dangerous infection, and every medical person who takes care of these people understands that there's a risk, even if you are perfect in using all the gear.
Fears of the outbreak have prompted neighboring Nigeria to screen incoming airline passengers for symptoms of the illness.
The risk from casual contact from people who've come back from Africa is really zero. It is the fact that you have to have very intimate contact with people's bodily fluids that puts you at risk.
A group of doctors and nurses from Children's Surgery International in Minneapolis has now canceled its medical mission to Liberia to provide free surgeries for 200 kids. The group decided the danger is just too great. Mark Albert, CBS News, Washington.